We are here with another episode of Eyecare today at the studios here in Hazel Township, our office, Hazleton Eye Specialists. You know, we are not only in Hazel Township, we're also in Tannersville, that's Stroudsburg Eye Specialists. And our newest location, we are just so unbelievably excited about. Pottsville Eye Specialists now serving the entire Schuylkill County region. So that new office is at 541 West Bacon Street in Palo Alto proper, Palo Alto as they say in the Schuylkill County region. And we would love for you to come check us out at that new office. Give us a call. Here's our telephone number. We are accepting appointments for all ages from birth on. We are doing advanced dry eye care, advanced glaucoma care, macular degeneration, glaucoma, access to surgical care, like we have at all of our other offices. So very excited. So give us a call there. Of course, we are accepting new patients in our Hazleton office. So give us a call there at our Hazleton office and also in our beautiful office, still a new office in Tannersville, Stroudsburg Eye Specialists, right down the road from the outlets on Route 611. Give us a call there too. So we are so excited today to be talking about injections. Yes, injections. And I'm excited because hopefully we could, get rid of these at some point in time. We don't have to be bathing in this, and we won't be worried about, whether or not we have enough toilet paper either. We're talking about injections both in public health, in safety, and in eye care, because there's a lot of injections in eye care, some that are really revolutionizing the way that we practice and the way that we deliver care. So the first hot topic I'm going to talk to you about is the coronavirus vaccine. I, as many of you know, am a master in public health. So what does that mean? It means that I went to school a little bit longer to gain some additional information about public health. And what is public health? Public health is the study of disease processes, interventions, and ways that we can understand the way that diseases occur and how we should intervene on them on a grand scale. So instead of just looking at a patient in front of us, how do we think about it in a more community-based or national-based type situation? That is what public health is. And so we studied the study of epidemiology, and that is, the way that diseases affect large populations. We studied biostatistics, that is the math behind the way that diseases can travel through communities. And so, with everything that's been going on in this pandemic, that is a disease that affects large groups of people across multiple continents, we have, I've been having my ears ring a little bit back to my biostatistics and epidemiological days. And now we're faced with the opportunity to hopefully get rid of these things with the advent of a vaccine. Yes, a vaccine. And I know vaccines can instill fear and worry and anxiety and a lot, mostly due to misinformation. But this is not a conversation today about politics or any personal feelings. I'm just going to talk to you about the facts, and that is the science behind vaccines. Here's a picture of me getting my vaccine. I'm proud to have said that as a frontline healthcare worker that we were given priority to get the vaccine and we're able to get it. Here's Dr. Kislin also getting his, and we're proud to say that all of our staff has been able to gain access to that as well. So when you come here to our office in any of our locations that you're in a safe location. So what is it? What is a vaccine? Well, vaccines, I think, have this, funny way of spooking people, and I can understand that. We're sticking a needle in our arm. Needles are definitely a spooky thing. It's something that, certainly we've all had probably some fear of at some point in our life. And then we're injecting this thing into our body that we are going to alter the way that our body does something. And so the neat thing about vaccines is that they should not cause any harm. And that is, obviously the first thing to understand. And that the studies that have done to bring the vaccine to market prove that. Before they are able to, of course, gain FDA approval, they are, of course, going to have to go through some very strict regulations, guidelines, and safety protocols to make sure that they are not harmful. And so when we're speaking about the vaccines that we're aware of, there's really some broad buckets or categories of vaccines. There's vaccines with weakened virus. That is a virus that's actually going to be able to potentially cause the symptoms of that virus, but on a lower scale. There is viruses or vaccines that have a dead virus. In other words, it's the virus, but it does not cause the ultimate symptoms associated with that virus if it was a live virus. And then there are this new category, there's some others, but there's this new category of virus called an mRNA virus, and that's what you're hearing a lot about. And that is what the Pfizer COVID vaccine is, and also the Moderna COVID vaccine. And so this mRNA virus is interesting in that it is not a virus at all. It is just this little recipe, if you will. And that recipe you could think of as a recipe for our own genetic makeup, our DNA that we have in our body to make something. And so just like any recipe, you maybe have the directions to make cookies or cake. In this case, these directions tell us to make something that allows our body to build an immune battle towards a potentially real virus. And that thing that it makes is a spike protein. So many of you have seen pictures of this ball with little things jutting off of it. That's this spike that we've all heard of, something that I don't ever want to hear ever about again. That spike is what the mRNA vaccine is actually going to be telling our body to make. So what do we get? We get spikes in our body. Now, the spike is harmful when it's attached to the live virus. So what do we get? We get a bunch of these spikes, and our body does something in response to that, just like it would if anything else foreign was entered into our body builds an immune response. So we're going to learn a little bit more about that immune response and what we can expect with it, as well as some information about injections in eye care and some of the injections we do in our office. We're here at Hazleton Eye Specialists, Eyecare today, and we're talking all about injections. We'll see you real soon. What's up, everybody? Just disinfecting my general area here. And since we're socially distanced, I'm gonna take my mask off so you can see my face. I know it's weird to see people's faces right now, but it's a beautiful thing, and I'm looking forward to seeing all your beautiful faces and your eyeballs here at Hazleton Eye Specialists. We're on the Airport Beltway, and we are accepting new patients. It's 2021. What a great way to start your new year with an eye exam. A new perspective and a new vision on the year to come. So of course we have our flagship office here in Hazleton at Hazel Township, and we're right by the Big Eyeball. You can't miss us. We're right by the Big Eyeball. We're also in Tannersville, Stroudsburg Eye Specialists. That's on Route 611, right behind Friendly's. You can't miss us there. Here's our address. And our newest office is in Pottsville. We are so excited. Pottsville Eye Specialists, brand new staff, brand new doctor, Dr. Brendan Connors, new to the area, and just a really great doctor, and really passionate about eye care and providing a very high level of care. I will be down there also on a limited basis, but I will be down there, and we'll be offering, you know, the extent of surgical care and access to surgical care and injections. Yes, injections. We'll be offering access to injections. We're talking about injections here today. And, you know, we're talking a little bit, we were just talking about the coronavirus vaccine and you know, how it works, because I think, you know, there's a lot of misinformation and information and swirling things about in reference to it, and so we would love to be your voice of medical information here at Eyecare today. So both Dr. Kislin and myself have gotten the vaccine and are doing well, had no real side effects to speak of. So how does it work? So this is an mRNA vaccine. So in review, we said that what is in the vaccine itself is mRNA, which again is a instruction. It is a recipe, if you will. It's mRNA. We have some salt, we have some sugar, and you know, that is basically it. Also some fat, some lipid. And so what happens is, as that is placed into our body, our cells recognize this mRNA encapsulated in a little fatty tissue, and it tells our genetic makeup how to make a protein. That's what mRNA does. It tells our body how to make a protein. It does not tell our DNA to be different. So it just tells our machinery how to make a protein, and then it gets dissolved. It does not change our DNA in any way. So when it tells our body to make a protein, the protein that it makes is the spike virus that you've heard so much about. So our body then is able to make its own spike virus. And the beauty of this is that it is not the live virus. It has no COVID-19 in it. There is no coronavirus in the vaccine, and there is no coronavirus produced as a result of the vaccine. So there is no way to get the coronavirus from the vaccine, just the spike protein. Our body recognizes the spike protein and produces something called an antibody, so that if our body is introduced to the coronavirus, it can then mount a successful response to it and beat the virus without having significant symptomatology. Now, what's unique about the coronavirus vaccines that we have so far are that they need to be stored at very low temperatures, and that they require 2 doses. So currently we have the Pfizer and Moderna vaccine. Both are mRNA vaccines. As I've just described, they tell our body how to make a protein, not a live virus, and they mount a natural response to it and require 2 vaccinations. So that's what's going on so far in the world of the coronavirus vaccine. Lots of questions out there. Feel free to ask us if you have questions about it. We'd be happy to answer any questions that you may have. Some very common ones are, you know, can I get sick from the virus? What sort of side effects are there? The most common side effect, you know, so far has been injection site pain or discomfort, sore arm. I had a sore arm for about a day after the injection. The same with my wife, the same with Dr. Kislin. Neither one of us, any of us, had any other reaction. Certainly, there is the potential for irritation beyond that. Allergic reactions have been reported. So certainly, you want to have a discussion with your primary care provider about, you know, your ability to get the vaccine. But we're excited. We're very excited, and we wanted to share our excitement, our knowledge, and also our experience with you to let you know that we're here, we're following the science, and we are doing everything we can to provide a safe environment for you, for your loved ones, and for our community. And we're very excited about 2021 being a year where we can get rid of the masks, hopefully, and not have to worry about whether or not there's going to be toilet paper at Walmart. So vaccines, injections, and so on sort of spin us into a different direction. And so some of the most exciting things in eye care over the last 10 years have been in the world of injections. And I'll be honest, lots of times that you and I have talked about injections here on the show, I've been scaring you. I've been spooking you. I've been using it as a scare tactic to try and get you to do what I want you to do. And an example of that has been in diabetes, in diabetic care. We love the opportunity of being able to first identify diabetes in patients' eyes. Why? Not because we want to see people lose vision or suffer, but because we can use the unbelievable blessing that we have to look in someone's eye to hopefully turn their life around and reduce the likelihood that they suffer from stroke or heart attack because of diabetes. So if we can identify diabetes early on, we could tell them, hey, look, we need to change things. We need to get your life under control here, get your blood sugar better, and hopefully they never have to lose vision or, more seriously, suffer a stroke and die. So why did I say that I scare people with injections? Well, because if diabetes gets out of control in the eye, it gets beyond a point where simply getting blood sugar under control is enough. Another condition is macular degeneration. If macular degeneration gets out of control, it may get beyond a point where what we can offer from an eyeglass perspective or even supplements perspective is enough. And injections may be the answer. So we are going to come back and we're going to change things. We're not going to talk about the coronavirus vaccine anymore. We're going to talk about injections in eye care, specifically for diabetes and macular degeneration. Stay tuned. Hey everybody, Dr. Deom here at Hazleton Eye Specialists. Boy, am I excited. We are starting 2021 off with a bang. Wonderful news. We are opening our Pottsville office. We have a large parking lot dedicated to our office only. Easy access, wheelchair accessibility, and a beautiful new optical area with the area's largest, most up-to-date supply of ophthalmic frames in all shapes, colors, sizes, and again, a brand new doctor, Dr. Brendan Connors, going to be there full-time, offering the top-of-the-line eye care to all of the residents of the Schuylkill County region and beyond. So give us a call at Pottsville Eye Specialists. We are very excited to serve you in the Schuylkill County region. Super excited to be offering the top-of-the-line care that we're offering here in Hazleton, Hazel Township, PA. You know, we're right by the Big Eyeball on the Airport Beltway. You cannot miss us. We're accepting new patients. Please give us a call in Hazleton. Also in Stroudsburg Eye Specialists. Specifically, we're in Tannersville, right behind 611 on Route 611. You can't miss us. Go to the outlets, have some fun, do some shopping, and come get an eye exam afterwards. Give us a call there in Stroudsburg. We love our beautiful location there. We've been talking today about a varied mixture of things. We started with the discussion around the coronavirus vaccine. We're very excited to have gotten the vaccine here at the office in an effort to protect you, our patients, and our community. We're very excited to be doing that and educate you a little bit about the science behind the vaccine. And we transitioned into now a discussion about injections in eye care and how injections in eye care can be a very spooky thing, not unlike a vaccine, because we're placing a medicine inside our body with a long, sharp, pointy thing. And that's an injection. And these injections don't go into your arm, they go right into your eyeball. And this is something that definitely instills fear in a lot of folks. And the main area that we do injections in eye care here at Hazleton Eye Specialists, Stroudsburg Eye Specialists, and Pottsville Eye Specialists is macular degeneration. That's the number one reason we do injections. Dr. Patel our retina specialist is the doctor who administers these injections. And so we're just going to talk a little bit about this injection and how they work. So first and foremost, my job is to make sure that you never get to that point. And so one of the ways that you can assure that you don't get to that point is if you have a family history of macular degeneration, anybody in your family that you know that has had macular degeneration, your butt and everybody in your family, their butt needs to be getting an eye exam to make sure that there's no signs of macular degeneration, because we now know that if we do something about it now, when you don't have any symptoms, that is loss of vision, that we can maybe turn it around, that maybe we can reduce the likelihood that you lose vision at some point in time, and maybe reduce the likelihood that you need to get those injections at some point in your life. So what do we do? We do a thorough evaluation. We look at the back of your eye, specifically a very important part of the back of the eye called the macula. That's where your central vision is. And we look to see if there's any of this white fluffy material there called drusen. You could see that here in this picture. You could see a normal eye with no drusen and a normal healthy macula, and then a macula with this white material in it, again, something called drusen. What happens is this drusen disrupts the normal flow of nutrients from the blood vessels in the retina to the retina itself. And as a result, we get a degeneration. That degeneration starts out as this thing called dry macular degeneration, because there is no bleeding at this point, just degeneration because of this drusen, as you can see in this picture. If that degeneration progresses and the drusen increases, then we can get this abnormal growth of blood vessels, something called neovascularization. And neovascularization is never good. It's always bad. New blood vessels are not good. I was told in school that they are shoddy construction. They're bad. They don't know what they're doing, why they're there, or where they're going. They just think they should be there. And that's because the retina is not getting the oxygen it needs. And so it tells the blood vessels, we need more blood, we need more oxygen. And so they make these new blood vessels, they're shoddy construction, and as a result, they bleed, they break, and blood is toxic to the retina. And it causes, if left untreated, permanent, irreversible central vision loss. And just for a second, think that if everything that you looked at, there was a dark circle in the middle of what you were looking at. Every time you looked at your phone, every time you looked at your loved ones, every time you drove, there was a big black circle in the middle of wherever you looked, you would not be very functional. You wouldn't be safe to walk. You wouldn't be able to read like you wanted to. You wouldn't be able to enjoy the smile of your loved one's face. And so what we have now is the utilization of medicines that were once used in cancer care. The connection here is that with cancer cells, what cancer is uncontrolled cell growth. So what happens in cancer is we have an uncontrolled cell growth, and those cells need something very similar to what happens with neovascularization in macular degeneration, and that is blood vessels. So you get these blood vessels growing into these tumors, and they learn that if we could stop the growth of the blood vessels, we could stop the cancer in some cases. So they use that same medicine and they inject it into somebody's eye. And they found, oh my goodness, look, those blood vessels that cause the bleeding and macular degeneration stop growing. Now the problem is, it doesn't stop it forever. It just slows it down or halts it while the medicine is in the eye. So what happens is we need to do these injections every month or 2 months or every 3 months. There's been new medicines that do the same thing. They're called anti-vascular endothelial growth factors, meaning they slow down the growth of blood vessels, vascular growth factors. They slow that down or inhibit it. There's new ones now that last longer. So the same exact process occurs in diabetes. With diabetes, we get new blood vessels that grow, they leak, they bleed, and those injections can stop the bleeding. And so injections are not only important in public health and in stopping pandemics, they're also important in saving vision when it's really the last resort in macular degeneration and diabetes. But what's more important than getting there? Hopefully avoiding it altogether. And that starts with getting your comprehensive eye exam, especially if you or a loved one has ever been told that there's any signs of macular degeneration inside their eyes. We're probably going to recommend some vitamins when you come, omega-3s and lutein, zeaxanthin. This is a great start for folks that have a family history. This is an omega-3 and lutein and zeaxanthin. I take this myself because I have family history of macular degeneration. And then for folks that have dry macular degeneration, this is another great vitamin. It's a vitamin that has been shown by the National Institute of Health to decrease the rate and progression from dry macular degeneration to wet macular degeneration by about 25%. We are very, very proud here at Hazleton Eye Specialists, Stroudsburg Eye Specialists, and Pottsville Eye Specialists be offering you top-of-the-line eye care and access to injections in eye care by way of our extremely skilled retinal specialists, Dr. Sachin Patel and Dr. Casey Patel. If you have any questions at any point in time, give me a call. Ask for Dr. Deom. I'm happy to answer any questions you may have. We're always here for you. One thing that we're very proud of is offering 24/7 around-the-clock emergency care. That's on the weekends, at night, even on the holidays. We're here for you. Listen, we can't wait to see you into 2021, and have a great rest of your day.